Assalamu alaikum. Hello, dear friends. This is one of a series of videos about hospital policies and procedures, which are written instructions on how staff members do different processes. Policies are general rules that govern our performance, and procedures are sequential steps on how we do it and the responsible person for each step. We can update these rules when we have new standards to follow. In this video, we will talk about absconded patient policy. For more videos, please visit my Facebook page, Healthcare Quality, and my YouTube channel, Dr. Hassan Kamel. If you like it, please support me with follow and likes. This policy is applied to all physicians, nursing staff, security, and social services. Purposes of this policy are: 1. To define hospital responsibility for absconded patients. 2. To establish strategies to deal with patient goes absconding. 3. To provide guidelines on the role of the hospital staff in case of absconded patient. 4. To protect hospital staff from litigation and possible medico-legal consequences of patient absconding. And 5. To enhance security and safety of all patients. Definitions. Absconded patient: any patient who leaves the facility during hospitalization without informing the healthcare team in verbal or written form will be considered as absconded patient. Patients leaving emergency department without being seen even through registered will be not considered as absconded. Risk factors of absconded patient. There is a link between absconding and serious self-harm, successful suicide, and to a lesser extent to violent behavior. Absconding can also result in serious self-neglect, which can lead to death. Absconding may lead to catastrophic loss of confidence by relatives who expect the hospital to be a place of safety. When things go wrong, there is a possibility that legal actions may be taken. Absconded patient can be categorized into: high-risk patient is an individual who present a risk to themselves and or others, rapid deterioration in physical condition due to lack of medication and or treatment, at risk of physical harm due to their lack of awareness of surroundings. Medium risk is an individual who not considered to present any danger to themselves and or others. They have a little risk of deterioration in their physical condition due to being outside the hospital. Low-risk patient is not considered to present any danger to either themselves or others. Policy. 1. All absconded patients should be informed to the treating physician, nurse supervisor, and director on duty, and should be documented in the patient's medical record. 2. All absconded patients are considered discharged after 6 hours from the time patient left the hospital. 3. Absconded patients considered discharged and come back to the ward must be sent to emergency department for readmission. 4. An occurrence variance report should be accomplished in case of absconded patients. And 5. Determine the high-risk patient need to be allocated and recall again to emergency department. Procedure 1. Upon notification and confirmation of patient absence more than 2 hours, the nurse's physician will inform the security, nursing supervisor, and social worker after all exhaustive search has been made. 2. Security, with the help of social worker or patient relation, will call the patient and family. 3. Recall back the patient. The social worker and the patient relations will collect all the personal information about the patient from the medical record, as complete name, contact number of the patient and or his relative, and address of the patient. The patient will be recalled in his number and will discuss with him the reason of leaving the hospital, whether the care plan indicated any condition of leave or agreements for return, the condition of his illness and the risk posed on the patient health, the ability to be back again, and the policy of hospital if he did not come back. If the patient informed, a maximum of 6 hours will be allowed for him to be back again to the hospital, otherwise considered as charged. Police involvement in these cases of absconded. High-risk critical patient level 1 and 2. Confused dementia aged or drug addict. Female, child, and incompetent patient. Disabled or handicapped. Leaving the hospital with central or peripheral lines. History of self-harming. A police report must be made immediately by the nursing supervisor, aside by the documented report of social worker, and to be signed by the head nurse, charge nurse, director in duty, and police. The report will be made of 3 copies. Police will take original one. Second copy is in the medical record, and third copy with incident report. The treating physician will document in his medical record the incident as follows: date and time, when was last seen, when he or she absence is covered, the people who were notified, the area of search, police informed or not. Incident report should be submitted to the nursing supervisor for proper analysis and action. Discharge. Obtain discharge order from the treating physician 6 hours from absconded time. Then discharge the patient clinically and physically and encoded in the computer. If patient or family left any valuables, refer to safekeeping of patient belonging policy. All the information has to be documented in patient medical record by attending physician. Actions to be taken to prevent the risks of absconding or missing patients. Explain to all patients, and if relative is available, the procedure for notifying the staff if they wish to leave for any reason, and the reasons why notification is required. Develop and use a system for recording patient leaves for any reason and return. Ensure extra observation for patients who is going to be missed. Ensure that security keep check for the entrance. Responsibility. Staff nurse have to be sure that patient was absconded and determines the exact time of discovering that the patient absconded or the time of return. To inform the responsible physician that the patient was absconded or missed. To inform the head nurse and nurse supervisor. To write an incident report and to document what happened in the patient's file. Charge nurse. If the patient is high risk, the charge nurse will assign some staff nurse and security to search the patient immediately without waiting for return of the patient by himself in the corridors, bathrooms, smoking area, visiting his neighbor patients and external to the hospital unit. If the patient is moderate or low risk, charge nurse can wait for 1 hour to alert the security and start searching of the patient. At the same time, gather all available information concerning the situation. For example, when was the patient last seen? What clothing was the patient wearing? Known risks, history of previous absconded behavior, and current mental and physical status. Once charge nurse is sure of absconded event, he or she will write incident report for the possible hospital authority. Inform director on duty, social workers, and patient relations. Contact the available relatives to inform them the situation. Ensure that a full record is maintained. Ensure all clinical area is requested to check. And inform police if needed. Treating physician. He will review the medical record of the patient and assess his condition. Either determine the high-risk patient need to be allocated and recall again. Is the patient restless or displaying anxious or agitated behavior? Patient displaying confusion or known to have any dementia? If there is past or current history of self-harming behavior? Is the patient withdrawn from alcohol or other substances? Is the patient mobile? And is the patient smoker or not? The social worker have to collect all personal information, contact the relatives and inform them about the situation, and discuss with the patient the reasons of leaving and the ability to back again. Hospital right. The hospital will not be responsible for any sequelae or complication in his condition and any illegal act done in this period. Nurse leaders and nursing total quality management team review and monitor the implementation of this policy for effective compliance by all the nursing staff. Medical director is responsible for the implementation, monitoring, and evaluation of this policy for effective application. Here is an example of the incident report OVR form, first page. And here is its second page. Approval of each policy is usually done by the preparing person, recommended by the department head, reviewed by the nursing supervisor, and approved by the quality director, medical director, and hospital director. Thank you.